And welcome back. Well, are you happy with your Medicare plan? Is it a good fit for your budget? Well, every year you have the opportunity to make changes, and it's always a good idea to at least review it. This year's deadline for doing that, though, is this next week. So listen up. Cathy Harvey is with UnitedHealthcare Medicare and Retirement with Wisconsin. Good to see you, Cathy.
Nice to see you.
So deadline coming up on the 7th, which is Friday.
Yes.
So people need to pay attention, and as they kind of look at enrolling in Medicare for seniors, why is this annual enrollment so important? Is it really that reviewing and figuring things out that's so important for them?
Yeah, so choosing the right Medicare plan is really one of the most important decisions you can make just for your well-being as well as your wallet. And annual enrollment is really the one time during a year people can make changes to their coverage for next year. So if you've had changes this year in terms of your health status, your budget, or the benefits your health plan covers, now is the time. And as you noted, Friday's the day, so
yeah,
it's coming right up.
So you got to get on it.
Yeah.
I think it can be very confusing for people as they're looking at all the information or trying to compare where they're at and what they need. So do you have advice to make it a little easier for people?
Sure. We actually did a study last year of Medicare beneficiaries and found that 40% of people find it confusing. So if you find it confusing, you're certainly not alone.
I would think it's even higher. I'm surprised it's only 40.
I know. But really, we can help you navigate if you just ask yourself a couple of simple questions to find the right plan for you. So first, check to see if your current plan still meets your needs, and the benefits change from year to year, so take a look at that. Make sure it still fits your budget, and by that, look at not just what you're paying monthly in premiums, but also what you're likely to pay during the year in terms of co-pays, deductibles, and co-insurance.
Yeah.
And then check to see if your medications are covered, because even if you're not changing plans, those can change from year to year. Make really sure the doctors, hospitals, and even the pharmacists you use are in the network or in the plan that you're looking at. And then check out things like dental, vision, and hearing. Most people are surprised to learn that traditional Medicare doesn't cover those things or prescription drugs, and most Medicare Advantage plans do.
Yeah.
And then look at additional benefits for wellness. So most health plans have a lot of resources to help you stay healthy.
That's great. I mean, there's a lot to consider, and Medicare Advantage, as you said, is one of those things that truly seems to be an option that people need to consider when they're looking at all the needs that they have. So I understand that it's had rapid growth over the last few years. What do you think is contributing to that rapid growth?
Well, part of it is clearly the population growth in Medicare eligibles. You know, 10,000 Americans turn 65 every day. But even beyond that, the growth in Medicare Advantage has just been explosive. I mean, it's grown 40% in the last 5 years. And now 1 in 3 people on Medicare are on a Medicare Advantage plan.
Yeah.
And people really like it just because of the simplicity and the value that it brings. They like the convenience of combining all their coverage into one plan with one card and one company to deal with. And there's so many extra benefits that are available. I mean, in addition to things like prescription drugs and dental, vision, and hearing, a lot of Medicare Advantage plans cover even more extras, things like meals after a hospitalization or transportation to a doctor visit.
Wow.
Free gym memberships, which would be fantastic.
Yes, it would.
And even a free Fitbit. So really worth checking those things out.
Absolutely. Those things I think can truly benefit you. And that's one of the things. It's, you know, when we think of Medicare, sometimes we think of it simply as a health care plan, but it's really about your overall well-being. And it truly does do that for people. Absolutely.
So I can give you an example. One of our members, Melinda Lacey, she recently had knee replacement surgery, and she was pretty apprehensive about it. And we have this program called Navigate for Me. So when people have complicated healthcare situations, they get assigned a person to help them through that. So they have one point of contact that will help them schedule doctor visits, answer claim questions, address their social needs, and really get them through the system. So her navigator was with her through her surgery and through her follow-up. And Melinda said it really made her feel confident and taken care of, and that her navigator really became her new best friend. So that's really heartwarming to hear.
I love that. And I just think those additional pieces like that are just so important to us as we age, and we can't always be there with our parents or our grandparents. And so knowing that they're taken care of is so important for people who want to learn more about it, because that deadline, as we said, is fast approaching.
Sure.
Are there resources or places they can go to understand it better?
Sure. So if you're interested in UnitedHealthcare plans, you can go to uhcmedicarehealthplans.com or call the number on your screen. Or if you're just interested in Medicare in general, you can go to MedicareMadeClear.com.
I think that's a good one too. So I'll make sure everybody's got that information. So here's the phone number. So if you have more questions, you want to learn more about UnitedHealthcare, Medicare enrollment, Advantage plans, and more, dial 1-800-847-6145 or that website that Cathy said, uhcmedicarehealthplans.com or MedicareMadeClear.com as well for more descriptions. Thanks so much for being here.
Thank you.
Made it a little bit easier. Love that.